Welcome to our Menopause Rebirth podcast. Today's title is, and I'm sorry, I'm chuckling already, but today's title is The Tightness You're Not Talking About. Whoa. I am Dr. Charmaine Thomas, and with me today, I have Mrs. Natalia Fennell.
I know.
Sorry, I didn't mean to. I hope I didn't spoil it, but Mrs. Natalia Fennell.
That's all right.
She is a registered physical therapist. And today we're going to have a lot of talk. It's about the shifting, it's about everything tightness. I realized in the studio today, it's all about tightness.
It's very
Tighter.
important to talk about the tightness.
We're going to talk about tightness. All right, Mrs. Fennell, can you tell me a little bit about you?
Okay. Thank you for having me first
No,
and foremost.
no
So,
problem.
as you mentioned, my name is Mrs. Natalia Fennell. I'm a registered physical therapist and I'm truly passionate about women's health. I know anybody who knows me probably tired to hear about pelvic floor, but I really and truly am passionate about pelvic floor and women's health because oftentimes it's not spoken about enough,
So
hence the
true.
title of the podcast,
So
which
true.
is the tightness that we're not talking about. So,
Can I
big
talk about
advocate.
my tightness?
Not
All
right now,
right.
dog.
We're not ready to
Not
hear
here,
that?
not here.
Not
I
yet?
mean, we can talk
Okay.
about it a little later.
All right.
But yeah, so I mean, I am a wife, lover of God, and
Wonderful.
I just absolutely love people, love helping, love supporting, and I mean, wherever I can raise awareness in, especially about physical therapy, it's my baby too. I'm willing and able to.
Wonderful. Guys, I know her. I know her. We work together, and she is everything that she just said. She's God fearing. She loves her job. She is, I swear to God, she's also a masseuse because when her hands touch me, oh, Lord, the
Releasing
tightness.
some of the tightness.
All right, so we're talking about tightness, and I'm going to delve into a whole lot of stuff we're going to be talking about. But
Mhm.
I just want to share my little experience. Of course, I always have to. And I realized that when I do go to the gym,
Mhm.
I am tight. Like when I say tight, he's trying to stretch me because I
Right.
do have my own my gym trainer, and he's very good. I think he
Have the
learned a
same
lot from
trainer.
yes, the same trainer, and he and Natalia. I swear to God, they are awesome. But
Thank you.
he when I tried to stretch, which was totally different from when I was younger. Stretching when I was younger to me was so much easier. I was able to split. Yes, I was. But now it's just it takes a lot.
It does.
Yeah, my hip gets so tight, and he has to try and stretch it out in order for me to get back to where I used to be. And I told him I want to be flexible again.
Right.
Can you just like explain to me why it is at my age, 51? Oh Lord.
Looking good. Looking good.
Why at my age it's am I so tight?
Okay, so as we
Pun
know,
intended.
as we know, menopause causes a decrease in estrogen,
Mhm.
and hormones affect the whole body.
Okay.
So, in particularly, it affects the elasticity of the muscles. So you'll find that over time, if you have a decrease in elasticity, it's gonna be shortened and tightened much easier. So,
Oh.
side note, that's why I always tell persons get moving from you're young
Mm.
because you don't want to wait till something has happened and you're trying to fix it because then it's going to be much harder.
Okay.
But a part of the reason I think it's a little bit harder too is because I think people mistake mobility and flexibility. So
Okay.
flexibility is yes, how long a muscle can get for layman terms, how if you can go into the split as you say,
Mm-hmm.
but mobility is strength in flexibility. And that's
Gotcha.
why I'm very passionate about mobility side note because a lot of it is not talked about. People when you say stretch, they give you the hamstring stretch, they give you
Mm-hmm.
the quad stretches. But what about the hip opening exercises? What about the ankle mobility? What about your toe mobility? Like those things are very important because the whole body is a machine.
Yeah.
So every part is important. So if we neglect a part, then the other part has to compensate, thus resulting in that. Apart from that is a lot of the times our job has us in sitting or standing positions.
True.
And repeated posturing, the body works smart, not hard, right? So if it says, all right, I'm only needed to stand and sit, that's what's going to happen. You understand? So we have to be intentional of moving 360 degrees, not just
Agreed.
sitting and standing, but the diagonals, the twistings, the rotations, etc. So
Agreed. You
that's part
see,
of the reason
you see
why.
why I love her so much? Her knowledge, and not just that, you are able to demonstrate all of everything that you just talked about. And I've seen you do it with all the clients that you've had. I've seen people appreciate the fact that you help them through difficult situations. And I'm not just talking about menopause. Menopause, very important, but I'm
Right.
talking about every aspect of a person's disease process or whatever it is.
Agree.
Right? So I'm glad that I met you, and I'm glad that we will continue our journey together at work and otherwise. But I want to delve into silent suffering.
Yes.
Once again, I have to hold, look, I'm 51.
And that's
I
okay. Take your
literally have
time.
to hold it like this in order to be able to. Why are so many women walking around with locked hips, burning backs, and nobody's talking about it?
Ah, my favorite. Why? Because women are taught that we just need to be strong.
Yes.
If I got $1 every time a patient told me, a male patient said, no man, we can't
Male.
feel pain, a woman for feel pain.
Male.
Male persons like that. So everybody has the notion that all women were designed to feel pain. And yes,
Gotcha.
that's true to an extent. It's not the all and be all. So we don't talk about it because we're told, oh, we just need to be strong. Oh, it's just something that happens. Oh, it's the aging process. Oh, it's the hormones. Oh, it's pregnancy. So it's always an excuse as to why. So, and we don't get a chance to
Right.
really talk about it. Why? Because what's the point? Life goes on. We have to
Yes.
be wise. We have to be mothers. We have to be everything. But
Right.
sometimes in the midst of all of that, we neglect ourselves.
It's so
And that's
true.
why we don't talk about it, because when we talk about it or we try to talk about it, it's shunned or pushed to the side, sorry. And we end up suffering in silence.
Agree with you.
Another thing is that we get embarrassed easily. Ladies, please don't be embarrassed to talk about the issues. Please, please, please.
do.
If it is that you're uncomfortable with your provider, talk to Doc. She's really good. She'll make you comfortable.
Thank
But
you,
outside
thank
of
you.
that, find someone who you're really comfortable with and who
Yes.
listens and hears.
Yes,
Because a
so
lot of
true.
times we stay silent because we don't feel like we're being heard.
Heard.
We have
Yes.
back pain. Oh, it's a part of the aging process.
Yes, it's true.
Or hips are locked. Oh, let me give you some pain meds.
So
So what's
true.
the point in saying it if it's not going to be addressed?
How did you find yourself? What? I mean, you're a physical therapist. So, what happens when situation happen to you in which you need some help for? What do you do? Who do you turn to?
My other physical therapy friends. And
I understand.
honestly, sometimes I do suffer in silence too. And I wouldn't say suffer in silence per se, but it's more of a survival thing where it's like, okay, I have to take care of everybody else. So, they
Right.
often say doctors are their worst doctors.
Yes.
It's the same for physios too. So we're so busy taking care of everybody else, sometimes we forget to take care of ourselves. But one thing I've started doing, which is how we end up at the gym together.
Yes.
I make the first hour of my day about. I mean, after doing my devotions, of course,
Right.
about myself.
Yes.
So that hour is for me to go do my exercises because I don't want to wait until I'm in the perimenopause to menopause stage to
Right.
start doing something. So I do what I say from now,
No.
and I do strength training. I work on the mobility. It's not always fun and
It's
easy,
not. It's
but I have
really
to
not.
practice what I preach,
Right,
right?
right.
So I do that every day, and if I realize that, no man, I feel a little tight here, I feel a little locked in here, I address it. I don't wait till it becomes full-blown pain or debilitating pain
Right.
before I go to something.
Do you
And we
mind
have our little.
stating your age? I'm sorry.
No, I have no
Go ahead,
problems.
let
I'm
us-
29 in June, yes,
You're
June.
29 and
29
you
in
are
June.
so knowledgeable already
Thank
about
you.
certain things, and plus you're prepping yourself for when perimenopause come,
Right.
menopause and after. So this is a good thing. Do you
Right.
think that really should be an encouraging thing for other women your age?
Absolutely,
Right.
because the thing is, we don't know when we'll go through menopause. None of us have a roadmap as to when it's going to happen. And I think my mom went through menopause early, so if I'm following that trajectory, I may or may not go through it early. So why wait until the symptoms happen and then I'm like, oh my God, what is this?
Right.
What maybe I should have done something about this 5 years ago. So in order to extend the longevity of your life and
Yes.
the quality of your life,
There
it's
you go.
absolutely, absolutely important to start from now.
No.
You know,
Right.
prevention better than cure. That's what they
Yes,
say in Jamaica. Prevention is
exactly.
much better than cure, which means do something before an injury happens rather than wait till something happens and then you're trying to adjust.
Adjust.
Right.
So, is pain in menopause normalized, or are we just conditioned to suck it up? What do you think?
I think it's sometimes we don't know.
Mm-hmm.
And I think that's majority of the persons because the thing is, menopause kind of silent creeper. If you know,
Mm-hmm.
well, you know that
No,
because we
it's
talk
true.
about it all the
Exactly.
time. You know, it's like probably feel a little ache in the neck, and then 2 weeks you feel it in the knee, and then
Right.
everybody say, "Oh, you're just getting old."
Mm-hmm.
Absolutely rubbish. I mean, there's a little truth to it, but that's not the only
I'm
reason.
not getting old. I'm sorry.
Of
I am
course, 24.
20 something. Let's just keep that there.
Right. So I
Right.
think not knowing is one, and
Mm-hmm.
then because a lot of times they've had it for so long, so
Right.
based on the jobs that they might have had.
Right.
So if it is that we have a lot of persons who are domestic workers out there,
Mm-hmm.
or who do a lot of lifting or do a lot of traveling, those
Mm-hmm.
things affect the body, especially if
Right.
you're not coming out of those positions as we mentioned, so those sitting and standing.
Mm-hmm.
So if you're not doing anything about it, you have the pain,
Mm-hmm.
and then you just kind of live with it. You have a back pain here, and it might not be constant.
Right.
So sometimes it comes and you say, oh, it's gone. I go to the doctor, he gives me medication, excuse me, and then it's gone.
Right.
So you don't really think, okay, I need to address it because it comes and it goes. So I'll just
So
wait for it to
true.
go,
That
you
is
know?
true. So talking about that, what do you think? All right, persons my age, because everybody understand my age already. I told them I'm not ashamed to say how
You
old I
know?
am, right? I'm not even ashamed to say everything that I go through. It's just,
Right.
I don't think it should be a shameful topic,
I agree.
right? Now, in terms of aging, do you think the pain that a person feels in aging, do you think they should just suck it up and just say, oh, it's aging? The tension I'm feeling is aging. The neck pain, as you said, the lower back pain, the hip pain is aging. Do you think that women should just go through it and call it aging? I get that in my medical practice a whole lot. People come to me, and of course, before they finish talking about the pain they're feeling, Doc, I'm old anyway.
Wow.
And that is their diagnosis, old
Old
age.
age.
Right. So what do you think about that?
I think absolutely not.
Mm-hmm.
No, pain shouldn't be a part of anybody's life. I
Right.
mean, in an ideal world, of course, pain is a signal that something is going wrong in the body. So if it is that you're having pain, it's not just old age. Yes, it can be a causation, but it doesn't mean the all and be all.
Right.
And to be honest, Doc, I've in the past. I've only been a physiotherapist for 5 years, but in the
Oh my
past
God, it
two to
seemed
three
longer than
years,
that.
right?
Sorry. Yes.
But in the past 2 to 3 years, younger persons are coming to me. So persons my age and probably a little bit, I've had 20, 21-year-olds as well
In pain?
in pain, in back pain. And I'm
What?
thinking, but if you're in pain at
Right.
21 and you're not
Right.
doing anything about it, well, clearly you're doing something because you came to me. But
Right.
if you're in pain at 21, what's going to happen when you reach 40?
Do you
What's
think
going to
it's
happen when you reach
tightness?
50? I absolutely think it's tightness.
Oh wow. Is
Absolutely.
that a good thing though? Tightness?
Not this case.
Okay.
Not in this case.
All right, all right. I understand.
But yeah, I don't think you should suffer and say, oh, because I'm getting old. You can do something about it. I mean, I remember when you had some pain in the trap. Oh my God,
Yes.
that was some solid
Right.
tension there. And
Yes.
I remember just a quick 15-minute massage.
Yes.
You know,
And it so
and
helps.
you felt better. And I mean,
Yes.
it wasn't a one-time thing.
No.
I mean, we're privileged enough to work together, so we're
Right.
able to take care of each other,
I
right?
agree
So
with you.
it's a process, as you say. It's
Yes.
not a all and be all,
Right,
and
right.
not because you're having pain means that you have to suffer with it forever.
Right.
You
True.
can treat it, and if you have flare-ups, that's fine. That's normal
Yeah.
for some people. Not me. I'm not claiming it.
I am not claiming it.
Not
Like,
claiming it.
no
But
way.
if it is that you do have a flare-up, it's okay. You
Yes.
can just do something about it. Get the
Right.
help that you need.
Exactly.
Speak to your provider. If they're not listening, find a different one. I'm a
Exactly.
big advocate
No, it's
of doing
true.
that.
And
So.
guys, don't be a pill popper. Oh my gosh. Everything, every little thing, every pain that you're
Grinds my
feeling,
gears.
right? Every little pain of you're feeling, you're gonna pop a pill for the
Right.
pain. Well, how
Eventually
do
your
you get
body's
to the
gonna
root
heal.
cause of what's
Exactly.
causing that pain?
Right.
I mean, yes, tightness, tightness, tightness can be good and bad. You know what I'm saying?
Right,
But
right, right.
in this case, as
It's
you
not very
said,
good. No.
You sure
Not
it's
this
not
case.
right? Okay, all right. In this case, it's not right. All right, let's get to some controversial topics, right? It's like controversial cuts.
Mhm.
Let's do some gaslighting. Why are we stretching out our hamstrings when it's actually our trauma that's tight? That's
Um,
a good question.
it's a very good
Yes.
question, but because to be fair, I think again it's a lack of knowledge. A lot of people don't know that you can have pain, and pain doesn't have to persist as physical pain.
Mm-hmm.
Emotional pain causes tension in the body. Remember, the mind is very powerful, and what you think, you become. So if it is that you're stressed and you're not offloading, your body has no escape, no release. So your
True.
muscles tend to feel that. So the tightness that you're feeling, I'm not saying that there might not be anything wrong.
Right,
What I'm
right,
saying is to
right.
check it out, but there also can be another layer of
True.
it.
Very
Because
true.
honestly, my sessions as physical therapy, as doing physical therapy,
Mm-hmm.
it's probably 90% therapy, 10% physical. Honestly, because the thing
So
is,
what do you do
persons.
in terms of that 10% physical? Like how do you approach that?
So we have to get to the root cause, which
Right.
is why, in medicine, we have to get a good history. And a good history sometimes doesn't happen on the first day because, we're new, we're getting to know each other, we're not sure how comfortable we are.
Yes.
But the beauty about being a physical therapist is that you get extended time with your patients. So you get to know
That's
them, sometimes even
wonderful.
family members as well.
Wonderful.
And then
Yeah.
you realize, okay, they're carrying around a lot,
Yes.
and I can be more empathetic, I can be more sympathetic with
Yes.
them because I say, okay, though this person has back pain and it should be better in 6 weeks, 3 months, this is the reason why it's probably still persistent.
So true.
Right.
That is so true. Oh, it's a shame though that us as women have to go through all of this stuff without even sometimes having a way to release. You
Agreed.
know, tension is something that can be released if you're able to find the right avenue
And the root of the
and the
tension.
root of the
Right.
tension. So, guys, remember, all tightness isn't good, right? All right, another controversial cut. Can we talk about sexual dysfunction?
Absolutely. My fave.
I'm just saying. See, you see why I like talking to you? I'm gonna have you on my show again.
No
Trust me.
problem. I'm ready when you are.
Like women blaming themselves for the pain when it's really their pelvic floor. It
Right.
is true.
And then the thing is, that's another thing that women are embarrassed to talk about. Ladies, please, please, please don't be embarrassed. It happens to all of us. No, not because you're from this race or this class. It
Right.
happens to all of us as women. And the thing is, if you don't know, you don't know, which is why I think I'm very big on raising awareness.
Yes.
I talk about your pelvic floor all the time, all the time, because why? It's one of the set of muscles that are often neglected.
Okay.
And as we mentioned earlier, with menopause, it causes a decrease in the elasticity, which means that the muscles are not as pliable and
Right.
movable as
Yeah.
not movable, but not as stretchy as they
Right.
used to be. And then with estrogen decreasing, it causes a decrease in lubrication, and that can be painful. And it's okay, ladies, if you're not getting wet enough, it's not a symptom.
You
It's
can
not
come to me, by the way.
right.
That,
She
yes.
got you.
Yes, I got
But
you.
it's not something to be embarrassed about because why? It's your body's natural physiological process.
Certainly is.
Meaning it just happens because it happens, right? And yes, it might be difficult to talk about because when you're young and you're wet, you're good and you're feeling good, and then you
Right.
get older and your body's changing, and you're like, but it's not what it used to do.
That's true. So
But it's
true.
okay. That's
So
the beauty in
true.
growing older.
So true.
So there are things that we can do. I mean, prolonged foreplay is very important. Ensure that you're out of your mind because women were in our heads a lot.
But you're talking about prolonged foreplay.
Yeah.
This is Jamaica, man. I mean, honestly.
Ladies, get your man that does prolonged foreplay.
Like, I have to talk about it. Guys, I'm sure you want to hear. Don't you want to hear about it? Right. Remember to hit like, subscribe, okay, please, and follow.
Don't forget to share it.
Don't forget to share either. But let me ask you, prolonged foreplay.
Right, because then it also, outside of your body relaxing, it takes your mind off things. And then it might not be that you're not able to produce enough fluid, it just means that it might take a little bit longer to produce enough to be satisfied. So the reason why I said prolong, it sounds funny, but it's really true.
Yeah.
It's one of those treatments.
It's
Doctor's orders.
a treatment.
Doctor's orders. Prolong the
Lord have
foreplay.
mercy. Can I write a prescription for that?
Of
But
course.
let me tell you, I don't know if men are going to follow that. This is Jamaica. I don't know. I mean, I don't know. I guess I would need to ask or do some research. I have persons just write into us and let us know.
Well, let us know.
Prolonged
Let us know.
foreplay. Is it
Right.
something that your spouse is doing for you to assist you with lubrication?
Yeah, and then another thing I wanted to touch on with that too, with the pelvic floor, is that pregnancy is brutal on the body sometimes, and it's even more brutal on your pelvic floor, which means that, remember, you're carrying a life and everything. So your pelvic floor is the muscles. I probably should have started by saying that, right?
Okay, that's
It's
okay.
the group of muscles that forms from the front of your pelvis to the back. So it's kind of like I want to say a diaper.
Yeah, it does.
So
kinda
it's at the
have that
bottom, right? So it's literally holding everything above it there. So with pregnancy, remember, everything is pushed out of the way, so it pushes more pressure into the pelvic floor.
Right.
And oftentimes, what I found in my limited years of experience is that persons who had carried heavier children, or persons who were inactive before, or persons who had multiple children, multiple births, they tend to have more pelvic, they have back pain actually, and it's really not the back, but the weakness in the pelvic floor.
There you go.
So the back takes on more pressure than the pelvic floor because of that.
So
And
what do you think about the Kegel exercise then?
Oh,
Kegel.
Kegels are good, but the problem is if you are already having a lot of contraction, because another symptom is muscles being able to contract and not being able to release.
Gotcha.
And if you're doing Kegels with muscles that are already
Contracted.
contracted, it's not a good
Ouch.
thing. So pelvic floor therapy doesn't just involve strengthening, it also teaches you how to relax. So again, identifying the issues. So is it that you're tight? Is it that you're, no, I shouldn't say tight, you're all tight.
Tightness.
Is it that you're unable to contract? Is it that you're unable to voluntarily contract? Is it weak? Is it, spasmic? Is it all of these? So we find the root cause and then we tailor a treatment
So
per
true.
patient.
So
right?
true. Hi guys, today's episode is sponsored by Wix by Gray. Today's scent is called Strength and it's made from oak moss and amber. It smells so good. They're made in Jamaica and it is all natural scented soy wax. All right, so do you think doctors are downplaying physical symptoms in menopause because they don't know or they don't care?
I don't want to say they don't care because I would imagine you became a doctor because you have some amount of care.
Exactly.
But I would say is that honestly, sometimes the symptoms are so sporadic.
Right.
If you go to a doctor for the first time, if you have a family doctor, maybe he'll be able to pick it up better.
Yes.
Because he would have tracked your progress over the years. But if you say you moved,
consistent visiting of your family
right,
doctor.
just to check
you gotta
in.
get to know your doctors.
For
You have
sure,
to.
for sure.
Right. And stick with one doctor, guys.
If
Don't
they're good.
doctor shop. If
Yeah,
they're
stick with
good,
Dr.
right.
Thomas.
Stick with me,
No, it's true, but because you're able to pick up a pattern
Yes,
better
so
versus
true.
I'm meeting you for the first time, you come in and I hear all these symptoms. I hear probably one symptom, and then you go to another therapist or another doctor. You
Right.
tell them another symptom, and we're not really collaborating as healthcare professionals, unfortunately. Hopefully, we're changing that soon. Not everywhere. Some places do, because clearly we talk a lot, doc.
Yes, we do.
But we're not putting all the symptoms together to identify that this could be menopause. Because to be fair, the symptoms of menopause mimic a lot of other conditions.
It does.
Come to the workshop to know what it is. But
Good
you're
advertising. Thank you.
right? But the symptoms can be achy joints, and you might think, oh, I had the flu last week, so it's the flu that's causing the ache.
So true.
And then you go to the doctor, you tell him, oh, I had some sniffles. Because remember, when the doctor comes in, they're listening for a particular set of symptoms.
So true.
And then when you tell them your symptoms, they're trying to decipher what's important, what's not.
Very
So if you didn't think the aches in your joints were important, you're just gone for a cold, he's not going to catch that. He or
That's
she's not
true.
going to catch that.
Very,
So
very
I think
true.
it's somewhere in the middle of, yes, they downplay it a lot, and sometimes, I'm not going to say they don't care. I don't want to say that, but
Uh,
they don't care as much as they should.
Understand?
And then another thing is, I think women's health,
Mm,
sad to say, is that from your young, they downplay it. I
mm,
think it has gotten better over the years, but when
mhm,
you're young and you have painful periods, they're
mm.
like, oh,
It's just your
it's
period.
just your
Yeah,
period, you'll be
yeah.
fine.
Yes.
When in fact, it could be so much more. It could
Mm-hmm.
be fibroids, it could be
Mm-hmm.
cysts, it could be so much more.
Mm-hmm.
So it's not just pain,
Mm-hmm.
and if I can scream it on the top of the mountains, I would, because it really is not just
Just
pain.
me.
Right.
I really appreciate your insight on this
Mhm.
because for me, when a patient comes and sit in front of me, I look at the patient holistically.
Right.
I have had many patients that sit, start telling me about their symptoms, and start crying, literally
Yep.
crying. And
Agreed.
I sit and I listen. I don't say, okay, I have tons of patients waiting for me. Please hurry up and let me know what's going on with you so I can move
Move
on.
on. Right.
I try to take some time out to be able to understand them because a lot of times the pain is psychological,
Agreed.
right? It's not only physical, it can be psychological. So,
Right.
I mean, that's a thing that we just have to try and master.
That's true. And I
Yeah,
mean, I do
definitely.
understand the
Mhm.
caseload might be a lot, but
Mhm.
honestly, that extra 5 minutes, it goes a
Yes,
far way,
far
because
away.
it helps your diagnostic, process.
Abilities
Yes,
and
the
the
abilities and the
process
process.
at the
And it
same
also
time.
makes your
Yes,
patient feel comfortable, feel
very true.
heard, which is also very important.
Very true.
And they'll more likely come to you when there's a problem. If they're not comfortable, then they may or may not come back. You
Yes.
understand? So,
All right. So, next session.
yes,
Ready for me?
I'm always ready.
Why does my back lock up when I laugh, sneeze, or have sex? And nobody warned me.
Nobody warned you?
Nobody warned. Why does my back lock up? Tell me.
Outside of the tension,
Mm-hmm.
it could be that your pelvic floor needs assessment, because, as I said, we're all connected. So the back muscles in the back connect
Mm-hmm.
to the pelvic floor muscles, connect to
Mm-hmm.
the ones at the front. So
Mm-hmm.
if there is a disparity or a muscle imbalance in any one of those three chains,
Mm-hmm.
it will cause
Mm-hmm.
some problem. So you might have that clock pop locking dropping.
What is it now? Cock? What? What?
Pop locking
Pop. You
dropping
see?
joint.
Oh my God. She said pop.
Locking drop it.
Right. P.
Pop lock and don't drop it.
P, guys. P. All right.
So don't drop it. Just
All
pop
right.
it.
Don't drop it.
Don't
Just.
pop or lock it either. But that's because you probably have some overactive muscles, some weakness. So we'd
Okay.
have to go in and do a proper assessment before I can identify. Say yes, this is the cause.
Totally understand. Thanks for
Check
sharing.
me later.
Can menopause mess with your posture so much that you don't even recognize your own body?
Absolutely. Because
Mhm.
remember, we're in our youth, we're used to be, some of us, not all
Yeah.
of us. Don't come for me, ladies. But if you're used to looking a particular way,
Right.
over time, we might, the pooch. Oh my God,
Mhm.
let me talk about the pooch.
Yes. Talk
Because you
about
could
it,
be
girl.
working out and
Talk
everything is
about
all
it.
toned, and
Yes.
it's just the pooch.
Talk
And then
about
when
it.
you find out, what I find is that persons who are claiming to do abs or
Mhm.
um, stabilizing exercises,
Mhm.
they're really not activating their pelvic floor properly, which is
Mm.
why I'm so passionate about it. So you might, over time, what happens if it gets weaker and weaker, especially with multiple pregnancies,
Mhm.
it's distended.
Oh,
And
okay.
yes, there probably is some fat,
Mhm.
because menopause can
Mhm.
cause your to
Yep.
lose weight.
Fat distribution in
Is
weird places.
right, and
Yeah.
it's harder to lose,
Mhm.
right? But apart from that, the posture is, the
Mhm.
hips are tight,
Mhm.
kind of tilt your pelvis apart. Well, hips and back are tight.
Mhm.
Tilt your pelvis forward. In addition to those weakness in there, it's
Mhm.
like you're almost like a, I don't want to say P.
Mhm.
Can I say that?
It's okay. Go
Or
ahead.
a D. And that shape, it as a woman, it's not fun to see.
Mhm.
We want to always be nice and slimmed and toned.
Right.
So I think that's a
So
part of
are
a
you
lot of it.
saying that what we should do is, so when we're sitting, should we try to sit upright to kind of allow the
Right. So
pelvis to?
sitting like this
Yeah,
doesn't help.
doesn't work
Sitting
properly.
like this doesn't help. So what
Right.
I say is, try to keep your spine as neutral as possible.
And neutral.
But if
Okay.
you
Mhm.
think about it, engage. Like, think about, like, you're trying to hold your pee,
Mhm.
but like you're pulling everything all the way up on the
Mhm.
inside. And you feel your muscles contract. And believe me, when you do this for the first time, you're gonna be like, oh, I have some cramps here, which
Yes,
is good. It
it's
means that
good.
you're finally activated those muscles. If it is at its weakness,
Okay,
right?
guys,
If
we
it's
need to
tightness,
try
that's a
that.
different thing.
Yeah,
Yeah.
we really need to try that, guys. We have
Right.
to. We should. All right. So let's move on to the next segment as we
Mm-hmm.
are running out of a little time. I
No
love
problem.
talking to you, honey.
I love
It's
talking to you
like
too, dog.
so much fun.
Yes,
We have fun just discussing different topics. All right,
absolutely.
so let's talk about the resets.
Mm-hmm. Resets.
Where should reset, not resex?
I
You
said
see where your
reset.
mind is?
I said to
Lord
reset.
have
Now, where's your
mercy.
mind at,
No,
dog?
so no, Today's Sunday. Glory. Where should
Lord.
women start if they feel like they're lost control of their bodies?
Oh, that's a good question. Honestly, I think it starts with yourself.
Mm-hmm.
And the reason why I say start with yourself
Mm-hmm.
is you know what's going on with you best.
Mm-hmm.
Because, sometimes when you go to your friend first, it's like they tell you and you're demotivated or you're motivated to think something else. So I think it starts with you kind of just in retrospect, looking at, okay, have I really taken care of myself in the past month,
Right.
week? And then once you decided that, okay, because a lot of times when you start with a doctor, you don't really know what's going on. You just come, one thing happen and you go and you're like, all right. But if you just kind of take a moment, think about it, self-analyze, and then I would say depending on what it is that's going on. So if
Right.
it's psychological, because some women they only have psychological problems, they're
So true.
physically it's fine.
Yeah,
Then
you're
I would
right.
say start with a healthcare provider who is specialized in that field.
Good.
If it is that you're having digestive issues,
Right.
you go to that person.
Good.
So whatever it is, I think identifying what's your main cause,
Good. And
or just look for Dr. Thomas. She'll
just
know how to
come
put
and
it
check
all
me out,
together.
guys.
She'll know how to put it together.
All
But
right, so let's talk about. I'm going to give you a sentence and I just want you to finish it. All right? If your body could talk during menopause, it would say,
help me.
that's a good one, but y'all can come to me, okay, guys? If your body is saying, help me, I'm here to help. All right?
Absolutely.
Okay,
Absolutely.
so thank you so much for joining
This was
me
so
on
fun.
this podcast. It was so much fun.
Mhm.
Your body is not betraying you,
Mhm.
it's communicating with you. And if you've been waking up in pain, pushing through discomfort, and wondering why your body feels foreign, you're not crazy. You're probably tight, tense, and carrying things you were never meant to hold. Natalie, thank you so Natalia. You
It's
see?
okay.
Natalie. And I always call you Natalia. I don't know what's up today. You're gonna have a baby named Natalie. No.
In Jesus' name,
In
amen.
Jesus' name, hallelujah. All right, so thank you so much for joining me.
Thank you for
I
having me.
really appreciate you being on our podcast, and
Yes.
I am going to invite you again. I
I'm
appreciate
ready and
you.
waiting.
And remember, guys, you are loved. Take care.
Cheese.